Facelift incisions are something I think people will want to know and be well across. The brow and incisions are essentially undetectable. Upper and lower lid incisions in the creases or just under the lash line are usually hard to see. The main incision to really become knowledgeable about is the incision around the ears, because it's the one that may be potentially visible. So a facelift incision starts at the junction of the ear and the hairline, and then it runs down and goes behind this little structure called the tragus. So it's not in front of the tragus, it goes almost into the ear canal and then back out where the lobe attaches to the side of the head. The incision then runs up the back of the ear in the junction with the side of the head, and it may run then into the hairline. If there's really a lot of loose neck skin, then it may run down along the hairline to avoid creating baldness. So the aim of the facelift incision is to allow elevation of the lateral cheek skin, movement of that skin up and removal of excess skin and tissue, whilst having a scar that's hard to notice and not substantially changing the hairline. If somebody has already a lot of skin laxity, they will notice change in their sideburn area. Whatever you try and do to preserve it, you may end up moving the sideburn up and back a little. And so it just is something that we try really hard to avoid doing, but it may not be possible. If someone has a very lax upper and mid face, then the incision may be brought around the sideburn and actually at the junction of the hair and the temple skin, so it would be potentially visible. The only time that's done is where there's so much skin laxity that you would move the hairline back and make the person look bald if you had the incision within the hairline at that point. Behind the ear, kind of the same story. Usually the scar can be confined to the junction of the back of the ear and the side of the head and running up into the hair, so it's hard to detect. If someone's got a lot of neck skin laxity, it may be necessary to have the incision go along the border of the hair and the side of the neck so that the skin can be taken out without moving the hairline back and making it bald. Under the earlobe is an important thing to understand. So the incision transfers under the earlobe from in front of the ear to behind the ear. So if someone's got an attached lobe, then, and if you just stitched it back, you would see that scar quite clearly. And if there's any stretching, then you might pull the lobe forward, which is a really negative stigmata of facelifting. So what we do is detach the earlobe, and then you bring the skin around and up behind the ear, then you sit the lobe kind of on top of it. So if someone has got an already detached earlobe, then they usually won't see any significant change in their lobe. But if they've got an attached earlobe, to an extent they're going to have a more detached earlobe post-surgically. Some people really don't like that. It is possible to reattach it later. I'm reluctant to reattach it at the time because it doesn't give you any capacity to allow the skin to pull back a little bit. If you do that, the earlobe will look funny. So basically, expect if you have this incision to have just some minor changes to the temple hairline and the lobe appearance according to what your natural shape is like.